Good evening, and thank you for joining us on this special show on cancer care during a pandemic. I'm your host, Anisha Nair Thavat. The COVID situation across the country and the world has become a huge challenge for cancer patients. Just when we were recovering from the blur of last year after the outbreak of the pandemic and the subsequent lockdown, the recent second wave has come in as a rude shock. Thousands of lives have been lost, and many thousands continue to suffer, not just from the virus, but from the fear of contracting it. Chronic care patients, like those with cancer, are unable to access healthcare facilities, which were till recently overburdened. For many cancer patients, the lockdown has suddenly stopped their treatment, while their ongoing medicines make them more susceptible to COVID infections. Cancer has also emerged as a comorbidity. Due to this reason, it makes caring for a cancer patient challenging as well. Now, some experts are predicting another COVID wave later this year. It is important that cancer patients are aware of their risk and the precautions that they need to take. This program is supported by Roche, and on this show, we have an expert joining us to advise cancer patients on what should be their best course towards their treatment and leading a risk free, healthy, and happy life. To discuss how cancer patients and their families can cope with this double challenge, today we have with us Dr. Neelesh Reddy, consultant medical oncologist, Columbia Asia Hospitals Bangalore. Welcome to the show, Dr. Reddy.
Thank you, Anisha. Nice to be here with you.
Dr. Neelesh Reddy received MD in General Medicine at the prestigious Manipal University. He did his DM at the Cancer Institute at Yard. He is trained in both pediatric and adult oncology. He specializes in the management of solid cancers, hematological malignancies, including bone marrow transplant and palliative care. Dr. Reddy, what can cancer patients do to minimize their risk during this time? They say that the second wave is over, but we still can't put our guards down. So, what can cancer patients do to reduce or minimize their risk?
Yeah, two aspects of that. The first thing is COVID appropriate behavior, which is exactly similar to what each one of us who is living on the earth needs to do. Wear mask, maintain social distancing, and do not venture out of home until and unless it is necessary. This is absolutely basic thing what the patients of cancer have to do, and the same thing is applicable for the general population also. The second thing what is that the moment they have access to any vaccine, they should immediately go grab it and then take the vaccine. Because what we have seen, the difference between first wave and second wave is that those people who were vaccinated, they were significantly protected from death, from getting admitted to the hospital or going into ICU. Their infection might not have got protected by the vaccine, but definitely their becoming serious or critical was protected by vaccine. Even after the deadly second wave, we are seeing a lot of hesitancy, not only among general public, but also among patients of cancer, because they fear they are taking the treatment for cancer. Should we go for vaccine? Should not go for vaccine? Whether should we wait for Sputnik? Should we wait for Covaxin? Should we wait for Covishield? So that dilemma is playing up on their mind. But the data is very clear. Any vaccine, the first vaccine which you can have your hand on, go and take the vaccine. So COVID appropriate behavior with vaccine, this is one which is going to get not only patients of cancer, but all of us out of COVID.
Dr. Reddy, what have you seen in your recent experience? Now, as early as May, in Delhi, hospitals were overwhelmed, and in the latter half of May, hospitals in Bangalore were overwhelmed. We have heard dire SOS messages for hospital beds, for oxygen beds, for ICU ventilator beds, and they were all packed. The healthcare facilities were not able to keep up. Even maternity hospitals became COVID hospitals. So, what happened to cancer patients, those who had to come for regular chemotherapy or other treatments? Did they come to your hospital?
Yeah. So the number of cases of COVID were so overwhelming that there was definitely a fear among patients of cancer, whether they should go to the hospital, they should continue with the treatment or not. Good thing is that our systems were in place. We had the contact numbers of the patient. Patient had the details where they could contact our team members and clarify. What we had the discussion with them is those cancers where the treatment couldn't wait, like even delay of a couple of weeks would have proved to be detrimental to the cancer. So we had a discussion with them, and most of them continued their chemotherapy during the COVID peak also. But there will be a majority of patients, particularly with solid tumors, where delaying of treatment for a couple of weeks would not change their outlook from the disease point of view, and also protects the patient from not coming to the hospital or venturing outside the home, not only to the patient, to the family. So we had discussion telephonically, we had counseling sessions with them, and we requested their treatment to be postponed for 2 to 3 weeks. And once the peak is down and all of them are back to the treatment schedule, the only concern was the thing which we had experienced to a small extent in the first wave and now significantly in the second wave, is that those patients who knew that they're suffering from cancer, like for example, women who had noticed that there's a lump in the breast, they waited, and 2 months, 3 months they waited, and their early cancers got converted into a locally advanced or an advanced cancer, because they were fearing that if they come to the hospital, they will catch COVID. Even now, must be some people who must have found a lump or who must have found some sign of cancer, but still they are hesitant to visit their healthcare facility because of fear of COVID.
Dr. Reddy, isn't it a catch-22 for prospective cancer patients, or even those who know they have cancer and are undergoing treatment? Because what we understand is those patients who have cancer and are taking treatment may be immunocompromised. And in an immunocompromised person, COVID, the susceptibility to COVID is even higher. So isn't it a catch-22 for these patients?
Yes, definitely. I agree with you, Anisha, that it's a catch-22 position, not only for the patients, but also for the doctors, because COVID is a new disease. How it is going to behave in each individual, we still, by and large, we may have a good amount of information, but still not very clear, because it's just a disease which is a year and a half old. But what I suggest to the patients is have a frank and clear discussion with your oncology teams. Discuss that whether delaying the treatment by a couple of weeks, whether it is going to change the natural course of the disease or not. If the medical advice is that delaying the treatment is going to make a change in their course, because certain cancers like acute leukemia, AML and ALL, they can't wait, because if we delay the treatment by 2 weeks, like there will be no more. But there will be certain cancers like hormone positive breast cancer patients or prostate cancer patients where the treatment can be withheld for a few weeks without any adverse outcome from the cancer point of view. So my suggestion to the patients is have a clear and frank discussion, express your apprehensions, find out what precautions are being followed at the center, whether the center is geared up to handle patients with following COVID appropriate behavior, social distancing. And second thing, what they can do is get vaccinated. Even a single dose of vaccine, the protection is reasonably good enough so that you can continue with your cancer care.
All right. Dr. Reddy, what about patients who are concerned about their families? Now, at one point, they're concerned about contracting the disease themselves when their immunity is compromised. Secondly, they also don't want to risk exposing their family members. We all live in a family. We may have young kids, old grandparents, all living under the same roof. So you don't want to take the risk to expose. You won't give a cancer to your family to your family members. But should you go to a hospital facility to take treatment and acquire COVID, you could spread it to your family members. So what do cancer patients do, and what can caregivers do to allay their fears or ensure that they don't contract COVID from the cancer patients? Should they acquire COVID?
Yeah, I'll answer this question in 2 parts. The first part is that when they visit the hospital, they acquire infection. Yes, hospital is a high-risk area where a lot of patients of COVID do come, and patients of non-COVID, including cancer patients, do come. But what we have found in our experience is, like, taking into consideration our doctor and the nursing team also, that the COVID appropriate behavior is much more stricter in a hospital setup than in an outside setup. So a patient has got higher risk, or a lay person has got a higher risk of catching infection outside the hospital than inside the hospital, because in the hospital there are IDT members, infectious disease members, who will be making sure that people who step into the hospital are wearing the mask properly, who are making sure that there is a social distance being maintained in the hospital, and they do not gather at a common place. Whereas when they step out, there is nobody to monitor. So many of the times we have seen that in the hospital they will be nicely masked, and the moment they step out, their mask will be covering their chins, their nose and mouth will be completely open. And we have also seen that just outside the hospital, there will be a eatery, and 4 or 5 people will be standing there and having their cup of tea or maybe a snack. So we feel the possible risk of catching infection in such places much higher than in infection, because their masks are down and they start mingling close to each other. So that is the first point. The second point, what can be done by the family members, is that a patient of cancer definitely is more susceptible to have a serious infection due to COVID. What the family members need to do, because they are healthy, many a times they may be asymptomatic carriers of the virus, and just they transmit the virus to a cancer patient, and then the cancer patient becoming sicker. So not only outside, even at home, if one of the family members is suffering from cancer, let other members follow COVID appropriate behavior even in homes also. When they go out and they are venturing out, when they come back, let them wash their hands properly. When they are going to meet a patient who is undergoing chemotherapy, let them mask properly, maintain good distance with the person who is undergoing treatment, and then interact and behave as if they are carrying the virus, and if their negligence can transmit the virus to a patient of cancer. So if there is a patient of cancer at home, let all the family members follow the COVID appropriate behavior even at their homes also.
All right. So it's advisable to follow COVID appropriate behavior at home, mask up at home as well. Now,
Yes.
I believe that cancer patients have to test for COVID before they seek treatment in medical or hospital facilities. Is this true for your hospital? Is this the general rule everywhere now? And how often should cancer patients test for COVID?
Yeah. No, the guidelines are not very clear on this aspect, that what should be done. What is generally followed in most of the centers in India and across the world is prior to certain procedures, they are making COVID testing mandatory. To classify the treatment of cancer, the treatment of cancer is classified by medical treatment, surgical treatment, and treatment with radiotherapy. Among these three modalities, what is very clear is people who undergo treatment for cancer with surgery, and if they have COVID, their risk of death in the post-operative period is very high. So most of the centers are recommending prior to undergoing surgery to get a COVID test done. Other indications is whenever a patient is likely to get admitted into the hospital, a COVID test is done. This is because in India, the hospitals are classified, they have classified their beds as COVID beds and non-COVID beds. If a patient who is COVID negative, if is admitted among patients who is COVID positive, he is likely to contract the infection. So to prevent the patient and in the interest of the patient, COVID test will be done at the time of admission. Coming to other modalities of treatment, like doing testing before chemotherapy, doing testing before radiotherapy, the guidelines are not very clear. But what has been generally agreed is those chemotherapy regimens which are very aggressive, where the patient is likely to have fall of WBC count or bone marrow suppression is high, there they suggest before the start of treatment, COVID test to be done. Whether the COVID test to be done prior to each cycle, there are no guidelines, and most of the centers are not doing testing prior to each cycle of treatment.
Right. Are all stages of cancer ones that make a cancer patient equally susceptible to COVID? Are those cancer patients with advanced stages of the disease at a higher risk of acquiring COVID?
Yeah. The risk of acquiring COVID is similar to patients across the stages. But how the patient behaves after the infection is developed, that varies according to the stage of the patient. People who are in good general health, whose cancer is in first, second, or third stage, they are doing better compared to those patients whose cancer is advanced or whose cancer is uncontrolled or who are on palliative treatment. They are doing poorly compared to the other set of patients. the risk of the COVID infection becoming serious and critical, they requiring ventilatory support or ICU support, is also more in patients who have got an aggressive or an advanced stage disease. Among cancers, hematological cancers like leukemias and lymphomas, and in solid malignancies, lung cancer, these are the subset of patients whom the infection can become more critical and can become life-threatening for the patient.
Dr. Reddy, in your experience in this recent second wave, what was the percentage of cancer patients who tested positive for COVID? And what was the kind of treatment that was required for these patients? Were they okay with just the COVID bed? Did they require ICU and intubation? What was your experience in this recent corona wave?
Yeah. So recently we had we collected the data of all our patients who were vaccinated and and also patients who had got COVID. So when we analyzed, we found that the rates of infection among cancer patients was similar to that of general population, about 3 to 4% of all the cancer patients. What we found is that people who were vaccinated, this irrespective of the type of the cancer and irrespective of the stage of the cancer, they did reasonably okay. Many of them, we were able to manage them with home quarantine. Small number of people required admission, but hardly anybody required ICU care or a ventilatory care. In contrast to those patients who were not vaccinated, the hematological cancers or those patients who got advanced disease, they deteriorated, and some of them also succumbed to the illness. What we have noticed is that patients who have completed their surgery and completed their chemotherapy and were not on any treatment, their behavior of COVID was almost exactly similar to the patients who had not had any cancer during their lifetime.
And the second subset that you're talking of, these are those who are cancer patients but vaccinated.
Yes. Yes.
So what you're saying is that vaccination is playing a very important role. So why is there a hesitancy amongst cancer patients to get the vaccine? And all the data that you've given me, I am now assuming that the cancer patients who were vaccinated were above 45, because the vaccination of 18 plus has only started recently. So all these patients were above 45, had received at least one dose of vaccination. And you're saying, despite having cancer, they were not really much worse off than the rest of the population who received one shot of vaccination.
Yeah. What we need to know is that generally cancer, though it can occur in younger age group also, is generally considered as a disease of elderly. The average age of patients with cancer in India as well as in the Western world is above 50 years of age. So because of that, a substantial number of people were eligible right from first time when the vaccination was opened up in India across geographies. They were eligible to take vaccine. But what happened is during that time, a lot of hesitancy was there. They used to come up with excuses that, no, I'm not going out anywhere. Why I should take the vaccine? I'm following all the precautions. Why I should take the vaccine? Or they will come that, no, I'm taking aspirin. I'm taking blood thinning medications. If I take vaccine, whether I will have more side effects or whether it will interrupt my chemotherapy. Those were the things which they had in their mind, and there was a hesitancy. But after the first wave, the second wave had hit, a significant number of them were convinced that they have to take the vaccine. That is the only way forward for them to get protected out of the COVID disease. But still, at least there are about 20-30% of patients who still are hesitant to take the vaccine, or they are waiting for a particular vaccine because they might have heard a rare complication with one particular type of vaccine, and that they will catch and tell that, no, I'll wait for Pfizer to come to vaccine to come to India, or I'll wait for Sputnik vaccine to be available and I will take it. The take-home message, what I want to convey to the audience is that all vaccines are equally good or equally bad. Whichever vaccine you have at your hand, please take the vaccine as early as possible.
Right. Dr. Reddy, usually when people take a vaccine shot, there could be mild side effects for a couple of days, perhaps even a week. For cancer patients, are these side effects severe? What explains this hesitancy?
Yeah. By and large, the side effects what the patients of cancer who have undergone vaccination is similar to that of general population. Many patients will have pain at the site of the vaccine, which lasts for most of the times 1 day and in some patients 2 days. A small number of people will have body pains and then fever. Hardly anybody has more significant side effects than this. Occasional patients, they have a drop in the platelet count, which will be a rare side effect. Maybe 1 out of 10,000 people can have it. Other than this, by and large, the side effect profile is similar between COVID and non-COVID patients.
Right. Dr. Reddy, if a cancer patient is undergoing treatment, will there be any tweaking of his treatment program, any halt in his medicines when he's taking a vaccine or in preparation to taking the vaccine?
Yeah, there is no special preparation which is needed to take the vaccine. What we suggest is inform the treating team once that you are taking vaccine on a particular day, because some of the chemotherapy regimens will be such that their platelet count may be very low. If the vaccination is scheduled during that point of time, we need to have some extra precautions like putting pressure at the site of vaccine so that the bleeding does not happen significantly. And there are 1 or 2 chemotherapeutic agents which, if the person is on that regimen and if the vaccine is planned, those medicines need to be avoided for 1 or 2 days during the regimen. Other than this, no special preparation is needed. Just keeping a word with your treating team, they will take care of the adjustment of the chemo medications, what needs to be done during that point of time, and based on the WBC count, they will also suggest the precautions to be taken.
Dr. Reddy, there are some experts who are predicting another wave coming soon, perhaps later this year itself. Now, perhaps at the end of the year, some of the fear had receded and now the fear is back. For those who may suspect they have cancer, those who may be at early stage cancer, what's your advice? How can they safely seek medical help? Because we don't want to contact the virus, but we do want to contact medical facilities so that they're safe and healthy.
Yeah. One is, again, as we had discussed for the last 15 minutes, since now vaccine is more freely available these days, go get vaccinated. Even 1 dose of vaccination is sufficient, reasonably sufficient enough to protect, so that you can visit the hospitals and carry on with the regular health screening and treatment. Even still, if there is fear, what I suggest is most of the centers now have online consultation. Whatever symptoms you have an online consult sitting at your home, speak to your treating team. What are the symptoms you are having? Let them assess what is the severity of the symptoms, and based on those severity, whether waiting for 2 days, 2 weeks, or 2 months is good enough for them to be at home, and then once the wave is reasonably under control, to come back for a healthcare facility. Even many of the investigations also now are possible at home, so that once you tell the symptoms, they can ask for a set of investigations which you can, from the doorstep, you can give for those tests, and then based on those tests, the treating team will take a call whether is it. See, basically, we need to delineate whether the problem what we are dealing is it an emergency, or the problem can be waited for few weeks, so that once the COVID wave is down, health attention can be paid to the patient.
Dr. Reddy, you're going to hospital, right? And lots of doctors, nurses, and medical staff go to hospitals. They face that risk every day, and they're still doing their jobs. Same is the case for policemen and other essential services. Now, if there is a need for imaging or to visit a medical center, is it safe for suspect cancer patients? What precautions can they take? Because I believe that even in imaging centers, there are some machines which are dedicated for those who are COVID positive and are coming for imaging, versus some machines which are for non-COVID patients, and there is a delineation. So when it comes to imaging facilities, what precautions should suspected cancer patients take?
Yeah, most of the hospitals have a protocol in which they are delineating or differentiating between COVID positive and COVID negative patients. In Bangalore, in Karnataka, or particularly in Bangalore, what they are doing is all the COVID positive patients, the images happens at the end of the day. Maybe 3 o'clock or 4 o'clock they start, and the scans runs in the night. and the morning hours is reserved for non-COVID patients. Also, specifically, what they do is, on some of the patients may not have any symptoms, and once the scan is done, then they will come to that, oh, this patient had lung changes which are suggestive of COVID. What they do then is, for the next 30 minutes to 45 minutes, the scanning place where the scan was done, that will be closed and it will be sanitized. And after that only, the next patients will be taken up for the imaging. That is what is done from a protocol point of view from the hospital. From the patient point of view, what can be done is, once you step into the hospital, make sure that there is no overcrowding, book your appointment and reach to the hospital exactly at the point. If you feel it is overcrowded, bring it to the notice of the concerned person there and tell that you are not comfortable and would like to come at a later date, or let them handle the situation of maintaining social distancing. Keep up your masks. Do not put the mask on the chin. Let the nose and face be appropriately covered. Wash your hands frequently. Do not touch unnecessary areas. What I have seen is, some people wear gloves and come to the hospital, and with the same gloves, they'll be rubbing their eyes, they'll be rubbing the nose. The whole idea of putting the gloves is that we should not touch our face. Even if, like we doctors, we touch patients, we examine their pulse, we examine their chest, and I do it without using gloves. But I make sure that I do not touch my hands to any other place until I wash my hands after examining the COVID patients. This ensures the safety of everybody. We will be preventing the transmitting to others, and will prevent the virus getting transmitted to ourselves also. So following COVID appropriate behavior and making sure that the hospital they visit has protocols in place where the patient's safety is taken care, they can ensure that they or their loved ones are protected from COVID.
Right. We're coming towards the end of the show, Dr. Reddy. Now, God forbid there is another third wave, or let's pray that there is no other third wave. How should cancer patients prepare themselves for normalcy after this pandemic subsides? And what is it, your last few words that you want to leave everyone who's watching the show with? Should they delay their treatment, because no one knows when this pandemic will end?
It's reasonably certain that we will have a third wave, but looks like the third wave is not going to be as high as what was the second wave. The reason being, our vaccination program has kicked in. We are vaccinating close to 30 to 40 lakh patients per day. So it's a matter of time, the number of vaccinations will pick up. Also, because of people who have recovered from COVID, taking the symptomatic and asymptomatic patients, it's a sizable number. So we may have reasonable amount of herd immunity to prevent as devastating as second wave, and likely that third wave is not going to be of same intensity, but definitely there will be a small blip will be there on the radar where the numbers will go up, but don't think to be that severe. So from the cancer patient point of view, what we need to remember is, even if somebody has contracted COVID, there is a 98% chance that the person will come out of COVID, which leaves only 2% possibility of death out of COVID. Whereas if the cancer becomes advanced, there the chance of cure comes down significantly. If the cancer is in fourth stage, then nobody is going to get cured of it. So let there be the fear of COVID, but the fear of cancer is equally important. So instead of living in fear, take appropriate precautions, visit or have an online consultation, take the vaccine, and see that the long-term health is not affected of the individual.
Definitely. You need to have a will to live, and for that, you need to take action. You need to keep your fear aside. You need to take your health in your hands. Thank you so much, Dr. Reddy, for joining us this evening and sharing with us your ideas, your expertise, your hands-on experience on what cancer patients or suspected cancer patients should do when it comes to seeking medical treatment for their condition at the time of a pandemic. Thank you so much for joining us this evening.
Thank you, Anisha.
That's all that we have for you in this show. Do follow us on Facebook to get all the updates on our upcoming shows. Till then, stay at home and take care. Goodbye and see you soon.